Pain in the hip joint area and the lateral surface of the thigh can occur as a result of issues with the Tensor Fasciae Latae. Watch this video to the end to learn the causes of the pain, exercises for self-relief of discomfort, and useful recommendations for preventing the recurrence of pain. I am Dr. Chernov. Enjoy watching the video. The Tensor Fasciae Latae is a relatively small muscle. It is involved in the flexion of the thigh at the hip joint, abduction of the thigh, and internal rotation of the thigh. The Tensor Fasciae Latae assists the gluteus medius and minimus in stabilizing. The pelvis participates in the stabilization of the knee joint as well as in its extension. This muscle also shows activity during the walking phase when the foot is placed, controlling movements. Bilateral contraction of the muscle aids in anterior pelvic tilt, while unilateral contraction causes lateral pelvic tilt towards the active muscle. This is why issues with the Tensor Fasciae Latae lead to anterior pelvic tilt and increased lumbar lordosis, as well as pelvic misalignment. Involvement of the Tensor Fasciae Latae with trigger points leads to the occurrence of pain, primarily in the area of the deep parts of the hip joint and the lateral surface of the thigh. Sometimes the pain extends to the knee. Prolonged flexion of the legs at the hip joint, for example, while working at a computer, causes significant discomfort. With even greater flexion of the legs in a sitting position or during sleep in the fetal position, significant difficulties arise with extending the legs. The pain significantly intensifies with movements in the hip joint and hinders fast walking. When attempting to lie on the affected side, significant discomfort arises. Sometimes a person cannot lie on the opposite side either, choosing to sleep on their back or stomach. Trigger points in the Tensor Fasciae Latae can be activated by sudden injuries, such as a sharp landing on the feet after a jump or any chronic overloads, such as exhausting running, prolonged walking, especially on uneven surfaces. While standing, they slightly bend the leg at the hip joint and experience difficulties when leaning back and extending the hip. Walking with semi-bent legs is not accompanied by pain. The Tensor Fasciae Latae can cause thickening of the iliotibial tract, resulting in the impression of shortening of the affected leg. In a lying position on the side, the knee of the affected leg does not touch the floor. To relieve pain in the hip joint area and along the lateral surface of the thigh at home, strong mechanical impact is necessary. Apply pressure to the trigger points of the Tensor Fasciae Latae and then stretch the muscle. Take a large massage roller and work on it with the muscles of the front and side surfaces of the thigh for a few minutes. Move slowly and find the areas of greatest tenderness. Pause on them for 30 seconds, applying intense mechanical pressure, and then massage the thigh muscles again. You can further enhance the massage effect using a small massage ball against the wall or a large massage ball on the floor. Press the ball on the trigger point area for 30 seconds. Breathe deeply and try to relax the tense muscle. After this, it is necessary to stretch the muscle. As we already know, the Tensor Fasciae Latae is involved in flexing the leg at the hip joint, abducting, and internally rotating the thigh. Exercises that involve extending the leg at the hip joint, adducting, and externally rotating the thigh will contribute to its stretching. The simplest exercise is the following. Lie on your healthy side. Extend the problematic leg at the hip joint and rotate it outward. After this, relax and let the leg drop down under the influence of gravity. Another simple exercise that helps stretch the Tensor Fasciae Latae, as well as other muscles that abduct the thigh, is the standing position. For this, the leg on the affected side needs to be moved back and to the side. You can stretch the muscle dynamically by holding the final position for 15 seconds, then returning the leg to the starting position. You can also use the post-isometric relaxation method. For this, you need to assume the final position for a few seconds. Perform gentle stretching against the background of calm and deep breathing. Then, tense the muscle strongly and with the next exhalation, stretch it even more. You can intensely stretch the Tensor Fasciae Latae with the help of exercises that also stretch the iliopsoas muscle and the rectus femoris muscle. For example, a position with leg extension at the hip joint and its more complex modifications. When the Tensor Fasciae Latae is affected by trigger points, it is necessary to avoid prolonged periods in a cross-legged position and with bent legs at the hip joints. You should not sleep lying on your side in the fetal position. It is necessary to avoid prolonged muscle overload, for example, caused by uphill climbing, driving a car without cruise control, or carrying heavy objects. It is necessary to adjust excessive body weight. Trigger points in the Tensor Fasciae Latae often occur secondarily as a result of damage to the anterior part of the gluteus minimus and medius muscles, the rectus femoris, the iliopsoas muscle, or the sartorius muscle. You can watch detailed reviews on these and other muscles in this playlist. Thank you for watching this video. I would be glad if you share it with your friends who experience pain in the hip joint and thigh area. Stay healthy and see you in the next videos.